A new bill in the Arizona legislature would require doctors to ask patients who want abortions why they're getting one. Cronkite News reporter Jamie Fossenkemper is in the broadcast center to explain this piece of proposed legislation. Jamie?
Senate Bill 1394 has support in both chambers of the legislature. Its goal is to require doctors who perform abortions to obtain the reason for the abortion. But some are pushing back against the bill.
This is a classic situation of a wolf in sheep's clothing.
Jody Liggett from Planned Parenthood of Arizona is adamantly opposed to SB 1394. If passed, doctors would have to indicate why their patients choose to undergo abortions. They would need to cite a specific reason, including economic reasons. The pregnancy was a result of rape or incest or relationship issues, among others.
This is a continuation of trying to erode the rights of women to make choices for themselves.
1394 doesn't just allow doctors to kind of, interrogate patients as to their reasons for abortion. It actually compels them to.
But Kathy Herod from the Center for Arizona Policy thinks this bill will make it easier to acquire data about abortions in our state.
Simply trying to define better why women are having an abortion, exactly what complications may be occurring from abortions, and that will enable, regardless where you are on the issue of abortion, but policymakers, healthcare professionals, pro-life and pro-choice people to better meet the needs of women.
If the woman refuses to answer, the doctor must indicate that on the report back to the health department, which Liggett says creates more problems for women than less.
Something that sounds like a regulation that is intended to protect women's health and safety actually does the opposite.
However, Herod feels that the information that would be provided would benefit women.
Data is always good in any area, but especially in the healthcare field, to understand what's happening and how to better serve women.
Current law requires doctors to report to DHS if an abortion is, quote, elective or due to maternal or fetal health considerations. The bill was scheduled to be heard by a Senate committee yesterday, but was held. And Cronkite News wants to hear from you. We have a poll on Twitter, and we're seeking your opinion on our Facebook post on this abortion bill. You can also track the bill's progress in our continuing coverage on cronkitenews.azpbs.org. Jamie Fossenkemper, Cronkite News.